Thank you for joining me again for another At the End of the Day podcast. I'm Dr. Cameo Carter. I'm a board certified pediatrician and mom of three. And today's reflection, I just want to go over. I had a parent ask me why their newborn needed a hepatitis B vaccine when it's only a sexually transmitted disease. And so I just wanted to take a few minutes today to clear that up. I wanted to talk about what hepatitis B is, how it's transmitted, and why babies are vulnerable, and why the birth dose is recommended. This has been something that's been asked of me since I started being a pediatrician. And I think it's a really good idea that you have a comfort level to ask your pediatrician any question that you have. It's important that you have that relationship where you can feel comfortable asking any sort of question. And so this has never been a question that I've minded. But I do want to make sure that there is not misinformation circulating. So hepatitis B is a viral infection and it attacks the liver. You can have an acute infection or you can have a chronic infection. So that's something that you can have right away and get very sick, or it's something that can be really long and drawn out. A lot of times it's silent, but it can lead to cirrhosis, liver failure. It can lead to cancer. And babies are at a much higher risk of being carriers than older people who can track the disease. So if they're infected, it can be up to a 90% risk of becoming a chronic carrier. And I think that's particularly important and really was a reason why this universal vaccination was recommended. So I think the big misconception that I want to make sure that I'm addressing is that it isn't just a sexual transmission. There are other ways that you can get it. And for babies, I think the route of transmission that's most concerning and important to note is that during birth, the actual birthing process, a baby can contract hepatitis B from their mother. But also you can contract it through any kind of open sores, things like bites. I think that's important in a preschool setting. I used to be a preschool teacher, and we would definitely have kids that were biters and could break the skin with those bites. But shared personal items like toothbrushes, razors, scratches, things like that can also transmit it. And of course, any kind of medical equipment, contaminated needles, medical procedures, that can cause it as well. And yes, sexual activity later in life can be a cause. So infants and children, I think it's important to note that they can contract hepatitis B in the home environment without anybody knowing. So sometimes someone can be a chronic carrier, not know that they have it. And in the home environment, it can be transmitted, or in a school environment. And that's one of the reasons why in the state I live in California, it is a required vaccination in the school setting. So I think it's important to think about, well, why is it that babies need to get that from the get-go? And this is why it was actually instituted to be given within the first 24 hours. So if mom is unsure of her hepatitis B status, or if it was wrong, or if she incurred hepatitis B from the time she was tested to the time the baby came, this could be transmitted to the baby. So this could also be if it was incorrectly recorded. So there can be different ways that a mom can unknowingly transfer hepatitis. Another reason why we give it right away is because it provides like that really early protection, and it makes it so that they're not going to end up contracting it. But this is also having a universal approach. Any time we can do things systematically and protocol oriented, that uniformity is helpful in making sure that we don't miss people and miss um, protecting them. It also creates a great safety net for babies. Not everybody has access to good prenatal care and to health care. There's lots of different reasons for it, which I'll reflect on probably on another day. But making sure we do this universally is helpful, because if you miss treating a baby early, it can have really dire consequences. It also is really great, and I think this is something that we don't always talk about, is that since it could also be inadvertently passed in a home environment, it's protecting a baby from contracting it through different means in their home in those early months. So giving it early can help with that too. So I think over the years, the questions I have, again, are good ones and ones I'm happy to have discussions with my patients. But saying like, I don't want to give hepatitis B yet because I know that I don't have hepatitis B. And so I think that is something to talk through with your doctor and decide if that is what you want to do and you want to choose to do it later. Certainly, usually still have choices about that. But sometimes moms don't know. And even if moms don't have it and aren't passing it through that way, again, home environment can be a cause of it. Why so early is another question that I get. And I think something to note about that is, in addition to the other things that I mentioned, it is lifelong protection once you get your complete series. And so that's something that is done, and you don't have to worry about having to get it in the future. There's a really great safety track record for this vaccination. It's been given for a really long time. It's well studied. It's very safe in newborns. Very low reports of there being side effects, fevers, warm bodies and swelling, any of those things. So just reflecting on, this discussion today and many that I've had, again, this is a decision that parents make, and I hope that they make it with their pediatrician. I hope that my patients, when they have questions, will ask me about my thoughts, and that we collaboratively make a decision together. But it isn't just a disease of adults or of risky behavior. It's a virus that can be silently transmitted. And the birth dose is about protection from day one, of making sure that babies are not contracting this and dealing with really, really serious consequences. So at the end of the day, as I'm reflecting on the visit I had today and many that I've had, the hepatitis B vaccine given at birth is safe, it's effective. I think it's a good idea, but be sure to ask your doctor about any questions and understand more about the virus and why we're giving it.